Hello world! So I'm going to start off my vlog series the right way and actually start at the beginning. Before I was diagnosed with leukemia, I actually had recorded just a video talking about some of my symptoms. It's actually kind of sad to watch now because I could just see in my face and everything just how sick I was, and I did not have any clue that I had cancer at that point. I just was experiencing these things, and I had just had my first bone marrow biopsy, and it's just sad, like I said. So I will start that clip here, and then I will catch up with you all after. Hey guys, this is my first ever video slash vlog thing that I have ever done. So I'm a newbie, I don't really know where to start, what to say, what to do, but I just wanted to make this video. I kind of feel compelled in a way to make this video. Recently I've been kind of diagnosed and been going through some really weird health problems all of a sudden, and I wanted to make this video to kind of share my experience with you all, just to get it out there to see if there's anyone who can relate, to kind of help them out so they'll know where to start, and just that they're not alone, because with a lot of things that's been going on with me here, I have felt like I am alone, and doctors have kind of made me feel that way also. So if there's ever something going on with you, just know you're not alone. So like I said, I don't really know where to start with this. I guess I'll just start by kind of just saying my whole life I've had trouble with my blood platelets. I've always had just low blood platelet count. It's called thrombocytopenia. Ever since I was young, they've done, millions of blood tests, it feels like. They even did a bone marrow biopsy whenever I was young, and everything kind of just came back pretty much inconclusive. They don't really know why I have this. It's just something that has always been present for me, and I've just learned how to deal with it over my 26 years so far of existence. But lately I've noticed that my bruising is pretty much the only major thing that I've had from my thrombocytopenia. I just bruise super easy, but I've never really had trouble with clotting, things like that. But lately I have been having trouble more so with my bruising. I've been bruising a lot easier, and I've noticed that my bruises are taking a lot longer to heal, which is definitely weird for me. It's not normal. Even though I, do bruise easily, they usually heal pretty quickly, relatively speaking. So just knowing that's been going on, that's worrisome. But let me back up again here. This all kind of started with my bruising more easy and my healing problems. It all started around February-ish of this year. I am working full-time right now. I work as a vocational counselor. I help people who have disabilities go through training or learn independent living skills and find a job in the end. That's our goal. And also, in addition to being a full-time employee, I am going to graduate school full-time, so that's a good time, let me tell you. But I just have noticed more so recently that my focus is off. It's harder for me to pay attention and really concentrate on my schoolwork at hand and really motivate myself to want to sit down and do this stinking schoolwork, because it's not a good time. And I am doing it all fully online programs. That's the only way that I could go to school and still work and pay my bills and everything. So it's just a whole different scenario than it was whenever I was an undergraduate. And don't get me wrong, I still definitely had trouble with motivation and focus whenever I was an undergraduate, but it's just intensified now that I am a graduate student and fully responsible for motivating myself to do these online classes. So anyways, I digress. I was having trouble with the focus and attention and concentration, so this past February, I kind of was fed up with it. I had enough, and I made an appointment to go talk to a psychiatrist to see why I may be having these troubles. I didn't know if it was maybe ADHD or if maybe it was kind of symptomatic, part of depression or whatever, who knows. So that's why I went to the doctor. And at the psychiatrist, they tested me, and they actually did diagnose me with ADHD. And that day, they started me on Adderall. They started me on low dose. They started me on 20 milligrams, and I don't even know what to say about it, really. Definitely, my ADHD is not severe. It is the inattentive type. I'm not terribly hyperactive. I mean, sometimes I, feel my oats and whatnot, but it is more so the inattentive type. And the way they diagnosed me was through, by looking at my IQ, because they had the full scale IQ, and then I did have a little bit of a deficit in my working memory and processing speed. So that little bit of a deficit, it was almost a standard deviation, but not quite. But that little deficit there is how they diagnosed me with the ADHD. So it was, my ADHD is not severe by any means. It's present according to my scores, but, I have lived 26 years with it. But I kind of just got to the breaking point with school, like I said, to where I finally just decided to go seek treatment, finally. So, like I said, they gave me my prescription, and I started on the Adderall that next day. And definitely, the first time I took it was, whoa. It hits you, and you do feel that euphoria, and you feel... You can feel it. It's different. I don't even know how to put it into words, but it's something else. But so I took that 20 milligrams for a month, and then throughout that month I started to notice a little bit of things were off. You hear people all the time talking about how Adderall really kills your hunger cues, and also you don't drink very often. You have trouble remembering pretty much to eat or drink because you're just focused on the task at hand, and you kind of just want to stick to what you're doing. So in addition to that hunger and thirst cues, I noticed it was kind of like wearing on my patience a bit. I do consider myself to be a patient person, but with Adderall, kind of had some trouble. I didn't want to be interrupted, I guess, and if, I was sitting talking to somebody, I had trouble, I just couldn't deal with it, I had trouble dealing with it if it lasted for a little while, because I want to get back to my work, things like that. So at my first follow-up appointment, I talked to the nurse who saw me about it, told her a little bit of my issues, and what they did, they decided to just up my dosage to 30 milligrams, which, again, I know is not a mega dose by any means. It's still kind of a baby dose. But I started on the 30 milligrams and took that for a month. What is today? This is May. Okay, so I started on Adderall February, and then in March I went back and started on the 30 in March. So from March to April I took 30 milligrams as well, and then from April until just recently I was staying on the 30 milligrams. So what was happening at my second follow-up appointment, I really voiced my concerns again about not eating well. His food I wouldn't eat breakfast, and then by the time lunch rolled around, I would have some kind of food, whether it be, quick fast food or whether it be something that I made here at home and took to work with me. It depended. But food was just, it sounded repulsive to me, which it's weird because I love food. I'm a major foodie. I always have been my whole life. Food is amazing. And it really sucked, to be honest, having this stinking medicine make food be repulsive, and it was bad. So I voiced my concerns about that, and I voiced my concerns about the whole thirst thing as well, because Adderall, I don't know if you all have had that experience or not, but it definitely makes your mouth dry, and then you kind of have cotton mouth 24/7, like, no matter how much you drink, don't drink, whatever you do, you have that cotton mouth. So that's not fun. But whenever I saw the doctor for my second follow-up appointment, I voiced those concerns and talked to them about my bruising and healing and things like that. And they really dismissed me, is the way I felt. They didn't really want to listen to me, and I understand that clinic is so busy. They see so many patients because we just don't have many options around here for psychiatric care, and I know they're busy, but not an excuse to dismiss your patients. So the person that I saw at that appointment, she left and went to ask the actual, I guess, residing physician, or whatever you want to call him, about my issues, and he came out into the lobby and talked to me about it, which was weird, but whatever. And he just was saying about how he has never heard of Adderall ever causing someone to have increased bruising and prolonged healing time. He just really said basically that it's not a thing. Which, okay, that's what he said, but still, I don't know. I know my body, and I know what I'm going through, and it just seemed odd to me. And then whenever I was talking to him out there, he asked me if I have any kind of primary care physician, which I didn't, and I know that's bad, and just in case you all didn't know, go get you a primary care physician, because it's really important. So he kind of scolded me for that, and after that appointment, I went out and was searching for a new PCP to see. Finally found one, and whenever I went to go see her, which was less than 2 weeks ago, actually, I finally was able to get in to see my new primary care physician. I told her about my history, my thrombocytopenia, my Adderall that I'm on. I just, gave her a full disclosure on everything. And, of course, they wanted to do your standard CBC and blood count and all that stuff just to check and see how everything's functioning. And she said that they would do the blood work, and then if everything was okay, they would just send me a letter, and I would return in 6 months for my appointment. But if something was wrong, they would give me a call for me to come in and talk about it. And before I left that appointment, I actually asked her also about Adderall and bruising and healing. And again, like the psychiatrist, she said that she had never heard of anything like that going on, about how Adderall was, very popular and is a well-known drug, and that there's just nothing really correlated there. So, okay, took that, went on, got my blood work done, and then went on about my day. The next morning, I was actually out at a high school for work, meeting with a new client, and I had got a phone call while I was in that meeting, and they left a voicemail for me saying that the doctor got my blood work back, and she wanted to talk with me ASAP. And so, of course, red flag, that's not good. I was freaking out just a little bit because I knew, I know my body, like I said, and I knew something was off, and just the fact that I knew it, and I just felt like no one really was listening to me, and now the fact that this blood work came back off, it just was really scary and kind of like an oh crap moment for sure. So that day, I was able, luckily, to leave work early, and I went to see my primary care physician again, and I was already kind of, amped up and scared, and my anxiety was super high, not knowing what's going on. And she walked in, and she had my results in her hand, and the first thing she said was, your B12 is good and your iron's good, but that's about it. Everything else is messed up. And that freaked me out, of course, because, my whole life I've known my platelets are off. That's me. But whenever she was saying that my red blood cells were low and that my white blood cells are practically non-existent, they're so low, I freaked out. And she was just talking about, she didn't know, she couldn't know just from my CBC what exactly was going on, but she just was saying about how it was very bad and how I was really sick, and that was kind of news to me, I knew my bruising was off and things, but being told that you are very sick, that's a holy crap moment. Like, I am, But she was talking just how she doesn't know what's going on yet, and that I need to go see a hematologist ASAP because it could be a whole variety of different things. So they referred me to a hematologist, and I went to go see the hematologist last Thursday, so just a few days ago. And my primary care physician said that they would be doing more blood work, obviously, and she said those dreaded words. She said that they would want to do a bone marrow biopsy. And like I said, I had one of those whenever I was young. I was probably maybe in 5th grade whenever I had my first one done, and it was just traumatic. I hated every second of it. The whole experience with it was bad. They put me completely under anesthesia for it when I was young, and I remember whenever I was coming out of anesthesia, I didn't know what was going on, and they were trying to take blood out of my arm, and I was ripping at everything, trying to get it out of me, and it was just bad experience. And so that is what just is stuck in my mind from this. Whenever I hear bone marrow biopsy, it's just, So I went to see the hematologist on Thursday, and of course, he did do more blood work, and I was talking to him, and then he slipped it in there. He's like, well, let's just go ahead and do the bone marrow biopsy today. And they rolled in the little cart that had all of the crap on it for the bone marrow biopsy, and there comes back all those traumatic memories of being a kid and having that done. So, long story short, I'll spare you the details of it. They did the bone marrow biopsy. They did not put me under full anesthesia. They just did a local lidocaine anesthetic, and that's it, and it was not a good time. But they did it, and it's done. And so now I have to wait a few, they said like 10 days to get the results back, and I'm going back here later on this month to talk to the hematologist again. And at that appointment, they will have more answers for me about what's going on. So I'm just very, very anxiously awaiting that appointment because I don't know what's going on, and it's scary not knowing what's going on with your body. And I don't know, it's just kind of just, like I said, I felt compelled to do this video in a way, and I'm not blaming Adderall or anything. I don't know for sure that is what the cause of my problems is, but I do truly believe in my heart that it is at least something to do with it. If it's not directly from that medicine, then it is from the way I was eating and the nutritional imbalance and not getting water or any kind of liquid, really, just not taking care of my body. like I said, I'd pretty much skip breakfast. I'd eat something for lunch, and then may or may not eat dinner, and then like maybe drink maybe 2 bottles of water if I'm lucky a day, and drink coffee in the morning because the doctor said that was okay. And turns out it's really not a good idea. I knew that wasn't the greatest idea, because Adderall, of course, is a stimulant, and coffee is a stimulant, and putting 2 stimulants together, not good. But I did it anyway. Grad school, it just, you do whatever to try and stay awake and get your work done, and it's just whatever. But I knew better, and I did it, so whatever. But I just was not treating my body well at all, and I think that that had something to do with what's going on. And so now I have taken myself off of that Adderall. I titrated it down, and so now I'm not taking it at all. And I'm glad. Like, I'm glad it's gone. If it wasn't for the food and stuff, then I'm glad that it's gone, because of the way it was changing my personality and kind of just smashing my patience and things like that. Like, that wasn't cool. That's not me, So that's gone. I'm just trying to eat healthy, drink water, things like that, because the doctor just said there wasn't really anything that can be done at this point. Just, eat good, rest, drink a lot of water, and that's pretty much it. And kind of just like hurry up and wait until we get those results back and until I can see him again. So, like I said, I'm not trying to blame anyone or anything. I just wanted to share my experience, and maybe someone out there is going through a similar experience, and I don't want anyone to feel alone, because like I said, I have felt alone throughout this, and it felt like I wasn't being listened to, and it's just a scary experience knowing that something's wrong with your body, but there's not really any known medical reason for it according to these doctors. So just, if you have trouble, like, speak up, really advocate for yourself, honestly. You know your body better than anyone else. No one else can really experience what you are going through, so speak up, please. And please, please, please take care of yourself. Eat healthy, drink your water, get exercise, and 'cause I know I have been so bad about this. I've taken my own health and my body for granted for so long, and now I'm in this situation that I don't know what's going on, that I don't know what's going to happen, and I'm really cursing myself for not taking care of my body for my whole life, basically. So please, just take care of yourself. Okay, so we are back to the present day now. Like I said, that video, it's just really hard for me to watch in a way, just because I can just see it in my face, in my complexion, and just everything, just how sick I was. And it's scary to look back and just think, holy crap, I had active cancer during that video and didn't know it. But I actually had more symptoms than just the bruising and concentration issues and stuff like that. So I'm going to make a second video of my cancer symptoms, since that first video right there was a little bit long. I don't really know how long I'm able to have these videos on and still be able to post them to YouTube. So I'm just going to split it and make this a 2-part video for my symptoms. So the second video will be here to come shortly. In the meantime, just be healthy,